Good morning.
Hello.
Welcome.
Hi, everybody.
Hi, everyone. I'm Kim Martino Sexton. Welcome to our Heartland Facebook Live. I'm here with my partner, Elizabeth Louder, and our special guest today, Brooke Kalisiak. Welcome, Brooke.
Hello. Thanks for having me.
Brooke is one of our fabulous physical therapists in the area who specializes in working with moms and families, and we're so grateful to have you with us. So Brooke, tell us a little bit about what you do, and then we'll move into what you do and how things have changed over the last, I know it's, what is it, 7 months? It's been a while. So share with us a little bit about your practice, Brooke.
Yeah, so I own Legacy Physical Therapy, which is a pelvic health physical therapy practice in the St. Louis area. And we specialize in helping women, men, and children with different pelvic issues. And we have a special place in our heart for helping moms to be and new moms kind of navigate their pelvic health and getting back to feeling the way that they want to feel and being active the way they want to be active. And so Legacy has been in existence for 12 years. I can't believe that.
Congratulations.
So I love serving the St. Louis community for that time. And we've grown over the years and have 3 pelvic therapists here. And we have a prenatal and postpartum fitness specialist that does both individual and group class programming. And so we're really just excited to be able to continue to, help serve the pelvic health needs of the St. Louis area and beyond, because we're looking to do some more online stuff for people too. So it's been a fun transition to see how else we can be helpful to people.
Well, wonderful. And what a great segue into our next question is how have you continued to serve families? And for our focus, we focus on moms and new families. But how have you continued to do that during this very interesting time? I don't want to say the word unprecedented, but out there I said it.
There you go. No, it definitely. One of the things it did is pushed us to do something that I'd wanted to do for our business for a while, is to actually offer virtual appointments. So before, COVID happened, we were all in person, and I love being in person with my patients. And I think there's, definitely something to be said for being able to do that. But we also had people who were driving a distance to come see us, or they had 3 or 4 little ones at home. And so finding a babysitter to then come to their therapy session and all that, it just was a big hassle for them. So when we had to go virtual for, the first, I think 2 months of this, we were all virtual with our appointments. And so we really had to adjust, and it pushed us a lot quicker than I probably was going to go to figure out how to offer virtual appointments for our clients. And now it's been great because we have this ability to, help people out, whether it's from the comfort of their own home or they're coming here. And I love doing a combination of it, especially when I'm working with new moms, because they're like, well, I feel fine when we're doing the exercises here, but it's really when I'm lifting my baby out of the crib that's bothering my back. It's like, all right, cool. Let's go in the baby's room. Like, show me how you do it. Like, let's practice it like that. And so we get to see them in their environment and make adjustments that way. So it's not, we're really able to tailor it down to them. And then also it can just make it easier where, I've had many a session where mom's breastfeeding their baby and we're also doing a session at the same time, and, being able to make it work that way for them, and able to help out moms earlier on postpartum, where they're maybe only 3-4 weeks postpartum and they really don't need to be coming out of the house to come see me, but they have questions and they want to get answers. It's like, cool, let's do a virtual appointment, and, we can talk things out that way. So it's been great to be able to offer those options. And what we found on the postpartum and prenatal training and fitness class side of it, we do miss our moms group here with everyone would bring their babies and come work out together, and we miss that togetherness. But Jamie's done a great job of building it as an online community and doing the classes via Zoom. And again, now we get to see it where, you know, all of like the toddlers and the school age kids are like running around in the background, and some of them are doing the exercises with mom. And
Which
so we
is
get
so
to
cool.
see that side of it. And so it's been fun to see that. And we've gotten to get a whole new group of women again, who maybe we don't have space at our clinic to offer babysitting services. So people could only bring their non-mobile babies, but now they can participate in the classes via Zoom and just have their kids, you know, either doing it with them or, you know, doing something else at home and that. So it's actually been helpful to us in some ways to be able to have more of these online options for people. So.
Excellent. Well, and I think that, you know, one of the things that is unique about your clinic is that you do offer these exercises or exercise classes, fitness classes. So talk a little bit more about that, because that's not typical at a PT office to offer these small group classes. I realize they're virtual now. However, that's still something that's not your typical.
Yeah, well, we wanted to do it for a couple of reasons. One, we wanted to create a community of moms and moms to be, so that they could learn from each other and interact from each other with each other. And so we really wanted that aspect of it. We kept seeing over and over again, our patients were coming to us and asking us a lot of personal training and fitness questions, like what are appropriate exercises? I have a separation of my belly, and you know, what can I do to help with that? Or my trainer says I should do this, but it doesn't feel right. Or I'm doing this exercise class, but it doesn't feel like I'm getting any stronger. And so we realized that there were not a lot of people that know really well how to train with pregnant and postpartum women. And don't get me wrong, there's some wonderful ones in the St. Louis area, but not everyone can get connected up with them. And so we've seen over and over again that women aren't getting necessarily great fitness advice, especially as they're coming back to exercise postpartum, or maybe wanting to start it up for the first time. It's like, okay, if you've never been active in your life at 6-week postpartum, you don't want to start doing a 45-minute high intensity workout because you want to lose the baby tummy. Like that's too much for your body. And so we wanted to provide education and fitness options where we taught people how to reconnect with their core muscles and their pelvic floor, and how to strengthen and build appropriately, so that they can ramp up to doing whatever they wanted to do, whether it's high intensity workouts, whether it's running marathons or that, but, you know, following that appropriate, like, here's how we strengthen and build over time for it. And so providing an opportunity for people to do that.
Wonderful. And so exciting to have made that transition to virtual. So that's still, because I know it's been really hard as a childbirth educator, talking with, you know, prenatal families all the time who are trying to figure out, you know, how do I continue, or how do I exercise during this time, and what's the best exercise for me? And so having that option is awesome. Do people have to be seeing you for physical therapy to be able to take part in the class that you offer?
Not at all. We have many people who are just working with us on the fitness side of it and that. And so like you said, if you've got a pregnant mama who's just not sure what's appropriate exercise for them, our program's called the Moms Made Strong program. And yeah, that's a very appropriate place for them to get in some exercise. Again, and we have both one-on-one options, or Jamie teaches 5 or 6 classes a week at various times a day that people can join in, and they're like 45-minute exercise classes, and she modifies it depending on where you're at. So we find out ahead of time, you know, pregnant, postpartum, how far, you know, what are your concerns, so that people, Jamie can modify the exercises appropriately for the person. Because when you said, like, you know, what are the appropriate exercises for me, I'm always like, there's no wrong exercise. There might be not the best way to do it, and it might not be the most appropriate exercise for you to do right now. But most people, when they ask me, like, well, is this an appropriate exercise? They hate my answer, because I usually say it depends. And they're like, what does that mean? I was like, it depends on how you do the exercise. That I may have a person who has a lot of core weakness and has a separation of their abdominal muscles that can commonly happen with pregnancy and postpartum, but they can engage well enough that they can do this plank exercise. And I have other women who they're not doing very well, and it's putting a lot of extra pressure through their system, or they're having some pain issues with it. and that exercise is too much for them. So to just say like, oh, you have this going on with you, here's your list of never do's and always do exercise. It doesn't work. It's how is the person, that individual person, doing the exercise that makes it either an appropriate or a not appropriate exercise for them at the time.
And I think that that's another really important distinction when we're talking about a practice like yours, Brooke, that, you know, you are tailoring things to the individuals. So it's not the same as going to, and there's fabulous exercise classes out there. So I don't mean anything wrong with that, but I think what's different about working with in, you know, a physical therapy practice is that, you know, you're tailoring things specifically to each individual, and you also have an understanding and a command of how, you know, the body physically functions. And so what you're doing may be different than what's offered out there at you know, a random place. I'm not going to name any names, but and so I do think it's you know, what I appreciate about, you know, what you're doing is that we can comfortably send our moms somewhere where we know that you're going to take really good care of them because you're looking at them as an individual, and you also have this command of the body and how it functions at different times. And so really truly appreciate that.
Oh, thank you. And, you know, really as to speak to the exercise classes that, you know, that are offered at various places, ultimately we want people to get back to what they want to be doing. And, you know, people ask, well, what's the best exercise? Like, the best exercise is the ones you'll do.
Right.
And so, you know, if, you know, we want to make sure it's something that you like doing and feel comfortable. And we've had many people who, I love helping people get back to a higher intensity exercise class, and they just need a little bit of time and individual attention to realize, okay, this is how I'm supposed to be recruiting these muscles. And, you know, then they come back to some of these exercises that they were doing and they're like, yeah, I wasn't feeling it that way when I was doing it there. Like I was cheating, but now that you showed me, like, okay, now I know what I should feel. I know what I should look for if I'm doing it right or I'm not. And, you know, like I said before, it's ultimately, I don't want to give people a list of like, here are your yes exercises and here are your no exercises. I want them to be able to go and look at a new exercise class or a new exercise and be like, okay, I can't quite do it how they're doing it, but if I modify it like this, I'm totally going to be able to do it and get the benefit out of it. And so giving people those tools to be able to go to whatever type of exercise they want and be able to see, okay, yeah, I can modify that, or that might be a little bit too much right now, but if I, you know, strength train for the next couple of weeks, I should be good. So really trying to empower women to be independent in their choices that they make and how they make good choices for their body.
So for those in our audience that are, pardon me, you know, OBs or therapists such as myself, or doulas, or anyone that's working with moms, what kind of things can we be paying attention to with our clients and patients that would indicate that, you know, your services would be helpful?
Yeah. So, I mean, along the lines that we're talking about with the fitness side of it here, I would say if they're asking about fitness activities, they feel really, they want to be active and they feel really unsure about, like, I don't know what's safe during my pregnancy. I don't know what's safe postpartum, or my girlfriend's doing this class and it sounds like fun, but I've never done anything like that. Is it appropriate for me? Like, physical therapists are really great at being able to decide and help assess how your body's moving and if something would be appropriate or if we need to modify for it. So like anyone who's wondering about fitness activities and if they're ready for certain things, especially in the pregnancy or postpartum time, would be very appropriate. A little bit more on if they're talking about symptoms or signs that they're feeling. So if someone is talking about bladder leakage or urgency and frequency issues where they feel like they're constantly there to go to the bathroom and they're going to the bathroom all the time. If they're having on the bowel side, either bowel leakage or constipation issues. If they're feeling pelvic pain or heaviness or pressure, some women describe feeling a bulge in their vagina. Or if they're dealing with kind of any type of like low back or hip pain, tailbone pain, pain with sex. These are all signs or symptoms that if someone's talking about this with you, that almost always there is usually a musculoskeletal component going along with it, especially if people have been dealing with it for a long period of time. The musculoskeletal system starts to adjust and can ultimately be part of the problem. And those are all things I listed that many people may not realize that pelvic physical therapy can be helpful for. And so these would be someone who is an appropriate referral to see a pelvic physical therapist to get their musculoskeletal system evaluated and get them moving on the right track.
Yeah. So, for I'm thinking of when I'm working with clients and I do a biopsychosocial assessment and things that they're complaining about, we always want to see if there's a biological component first. That's usually the first line of assessment is ruling out any biological reasons why their sleep is poor or their sex drive is low. It could be related to, well, it's uncomfortable every time I have sex, so I wouldn't want to have sex if it hurt. So, but in other words, kind of, so in addition to referring out to their OBGYN or referring out to a general practitioner, if there's something related to their body postpartum or their sex life or like urine leakage, stuff like that, then you are a perfect referral. I know we've shared clients and it's something that I'm really grateful for, that you're, trauma informed. And you've worked with a lot of clients that I've ended up treating that have issues with going to the OBGYN, like, difficulty with pelvic exams, vaginismus, stuff like that. And they've really felt very safe at your office. And you help them understand like what's going on with their body and it's not their fault. And there are things that we can do to treat what's going on.
Yeah, no, it's so important to give people the time and education. And like I said earlier, to empower them to be their own advocate for their health. And I really, that's how I describe it to my patients. Like, I'm just your guide and your partner along the way. I'm not fixing you. I'm not the one getting you better. I'm giving you the tools to help you help yourself. And, I will walk this path with you and we'll start this path wherever you're at and, walk down it together. And so I really tried to put the power back into my patients so that they can.
It's so important. And it comes through with the patients that we've shared, that they just really, you can tell they feel so comfortable. And that's where healing is going to take place, is if they know that they can trust, their clinician. And it's such a, sensitive, maybe stigmatized part of our body that we're not supposed to talk about, and it's taboo to talk about. So we already feel vulnerable and uncomfortable. We can feel uncomfortable when we talk about these things. And I really love how you destigmatize the language around it and take the shame and blame away from it, and just work on getting women back to feeling like themselves again.
Yeah, no, it's so true. And it's part of the reason why I did go out and create my own practice, because I wanted, honestly, to design it from the bottom up, as far as like, how can I make these people feel as comfortable as possible? Because they're going to come in and they're talking about uncomfortable stuff. And so I want the whole experience of it to be as comfortable as possible, so they feel like they're in a safe place and can share and know that they're doing the right thing, and that there's not 20 other people on the other side of the door doing exercise and stuff and being like, well, I'm not sure I want to have this conversation right now, or that's like, okay, that's why our practice is kind of a small, intimate place, because we knew that's the vibe that we needed to provide.
It's also very warm and welcoming.
Thank you.
We were talking before we went live about your hashtag.
Yes.
Common, not normal.
Common, not normal. Yeah.
So,
I won't. So it is a phrase that I joke with my husband, I'm going to get it tattooed across my forehead. So instead I opted for, we put them on, we just got new shirts for the clinic and I got our logo on them, but we put hashtag common, not normal on the back, because I feel like I say it all the time. And because people will be like, oh, I just had a baby and I'm still having a little bit of bladder leakage, but my doctor told me that's normal. And I was like, no, that's common. A lot of women deal with that, but it's not normal. After 6 weeks postpartum, you should pretty much be dry. There should not be any leakage happening. And if it still is, something else is going on. And, you know, the same thing can be said for pregnancy, low back pain, or for pain with sex after having a baby, or even prolapse issues. And it's like so many women have been told or have heard it from their girlfriends, and so they just think it's normal. And it's like, nah, it is, none of those things are normal. We're not all, you know, marching down the path to pain and diapers, you know. Like
Right.
there are things we can do about it. And yes, it may be very common, you know, 1 in 3 women will end up with some bladder leakage issues, but there are things we can do about it. And the beautiful thing is oftentimes there are things we can do that are very conservative in nature. They don't require medication. They don't require invasive surgery. And, you know, you can make a difference on your body in that. So it's kind of my mission to get out there that, you know, common, not normal, there's some things that you can do to make a difference. So
Yeah, I think that's huge to say.
Awesome.
For people to hear.
So now I wear it on a t-shirt so people ask me about it.
Yeah, I love it.
That's a wonderful phrase, so well put. And it's so important because we do hear it all the time. And, you know, for Elizabeth and I, we're, you know, always focusing on mom's mental health. And we know that these physical issues, you know, contribute directly to how we feel about ourselves and our mental health and our stress level. And so knowing when a doctor says to you, oh, that's normal, and you think, okay, so now I just have to figure out how I'm going to wear pads for the rest of my life, or that sex is just going to be painful. And now, you know, my relationship with my partner is however it is because of that, because I feel whatever way about it. And so knowing that, gosh, common, not normal, that is so important, because it is one of those things where women deserve to seek support. And I love that you mentioned that there's, I'll say easier solutions than medication and surgery. And that, you know, often women avoid these things because their OB said, well, it's normal. And then who else do you talk to? And that's what I've loved about this whole field of pelvic health and physical therapy, and this focus, because it gives women a place to go when they've been told it's normal. No, common, not normal. That's perfect, Brooke.
Well,
so exciting.
Yeah. Well, we know you have a busy day full of patients, and you've got to get back to them. So
I do.
Let you go. Thank you so much for joining us. Is there anything that you want to, any comment or thought that you want to leave us with? I've posted your website on the comments to this live. Are there any other
wonderful
anything else that we can share with the audience before we head out?
I can maybe find a way to, because I was thinking about this. I went and grabbed this earlier. So this is and it's going to be very hard to see, but this is a 10 question screening questionnaire that a colleague of mine created called the Cozine Pelvic Dysfunction Screening. And you answer simply yes, no questions to it. And if you answer yes to 3 or more of them, there's a pretty good chance that you have some pelvic floor issues going on. And the power of it, I think, is seeing all the different things. So like, I had no idea that could potentially be related to my pelvic floor. And so it helps people to think around like, oh, okay, wait a minute, there might be some other cause or contributed to it. So I will get you guys this. And if we can put it up in the, like as a link, or I'm not sure, we'll figure out how to get it out there, but it's just a great way for providers and the general public to be like, oh, okay, well, I might be dealing with a pelvic floor issue or a pelvic issue, and it may be beneficial to talk with a pelvic therapist. So that's another way to help, whether it's just you as an individual, or if you're a provider who's wondering like, how do I know if I, should be sending someone?
Yeah, we would love to share that with our group. Absolutely.
Yeah, I will get that emailed over to you guys, and you guys can get it out into the group. So it works.
Awesome.
Excellent. Thank you so much, Brooke.
You're welcome. Thanks for having me.
We so appreciate it. And common, not normal. We need to spread that hashtag around.
We do.
So thanks, Brooke from Legacy Physical Therapy. And like Elizabeth said, her link, we'll have that in the comments, and then we're going to find a way to share this. Did you say Cozine questions?
Yes.
Cozine?
the person who designed it is, her name's Nicole Cozine, and has actually done research on the validity and what
That's
is
great.
the specificity of it and that. So yeah, we'll get it over to you guys. So
Wonderful. We'll look forward to sharing it. Well, thank you
Thanks for doing what you do.
You're welcome. Have a good
great
rest
week,
of your day,
everybody.
guys. Yeah.
Bye,
Bye,
everyone.
everyone.
Thanks for
Bye.
coming. Bye-bye.